Only mode.
Welcome, everybody. My name is Norm Suchar with the National Alliance to End Homelessness, and welcome to our webinar today on implementing coordinated assessment under the new CoC regulations. Let me first introduce our presenter today. Our presenter is Kim Walker, who is with the National Alliance to End Homelessness. She's our expert on coordinated assessment and coordinated intake strategies. And before we get to her, let me just go through a few housekeeping notes. First of all, this webinar will be recorded, and we will make available the recording as well as the slides after a few days after the webinar is complete. Also, all of the listener lines are muted and will remain muted during the webinar. If you'd like to ask a question, on the right side of your screen, there should be a little box that says questions, and you can submit questions anytime during the webinar. And if you ask a question and it gets answered during the webinar, don't worry about it. We just won't ask it. But if you when we go to the Q&A section, we will go through those questions. So just type it in that question box. Anything we can't answer or really requires a lot more time to answer, we'll try to address in future blog posts or other materials that we produce. So with that, I'd like to welcome and introduce you to Kim Walker. Kim, it's all yours.
Thank you, Norm. I'll just get started by kind of going over what we want to cover today, and I think the screen's going to take a minute to catch up slide-wise. There we go. So today's webinar is really going to focus on coordinated assessment in the context of the release of the new CoC regulations. So we'll be talking about coordinated assessment in terms of what it is and what its key aspects are, what the regulations say about coordinated assessment, as in the Alliance's recommendations for implementing coordinated assessment under the new rule, and then some next steps for communities to take moving forward. So just kind of a basic summary of what's going on with the regulations right now. The interim rule went into effect on August 30th, so it's already in effect now. Comments on the rule, so it's being implemented, but you can also still make comments on it, are being accepted until October 1st, which I believe is a Monday. HUD has developed a number of webcasts and other kind of technical assistance tools around the rule to help communities implement it that are available on their Homelessness Resource Exchange website, which you can reach by going to hudhre.info. And since we'll post the slides after this, you can also just click on this actual link in the slide if you'd like. We at the Alliance have released draft comments that are now available on the front page of our website, which is endhomelessness.org. And we're also going to be putting out a set of recommendations on how to implement all of the regulations, not just the coordinated assessment ones. And we have also already released a summary of the rule. If you haven't seen that, I believe that came out a couple of weeks ago. So I'll just get started with this kind of what the rule says. What I've posted here is the definition that HUD gave of coordinated assessment in the regulations, and I put the section there as well if you want to find it for yourself. I've highlighted in red the areas that I think are the most important. So those are that the coordinated assessment system should include intake, assessment, and provision of referrals. So those are three key aspects right there. And also that it covers a geographic area, and that shouldn't just be the CoC-funded programs. It should be kind of community-wide as much as possible. It should be easily accessible to individuals and families seeking housing or services. So really need to think through how people will get to wherever they need to go to get access to things. It should be well advertised, so people should know how to find help, and include a comprehensive and standardized assessment tool. So we're going to go into these in a little bit more detail over the course of the webinar, but generally speaking, I'd say HUD left the definition here pretty broad. They kind of highlighted some key areas, but overall, I think the message is that communities need to develop a model for this, but there's a lot of different models that are acceptable. So here are just a few of the models for coordinated assessment that communities have used in the past, and I know the slide is catching up. And these are also some of the ones that are highlighted by HUD in the actual regulation. So I'll kind of do a quick overview here, and I'll say if you're interested in one model or the other or just want more information, our coordinated assessment paper, which I'll show you where to find at the end of the webinar, as well as HUD's website, both have more on kind of the pros and cons of each model. So a centralized model is really one location, so you're using maybe one building or one area to do assessment. It can mean one building per subpopulation. So a lot of communities may have a centralized model where they have one location for families, one location for singles, et cetera, and that's still considered centralized. Decentralized, on the other hand, includes multiple places and may even be every provider in the system. So if it's the latter, if it's that pretty much any provider can do the assessment or all providers can do the assessment and make referrals based on the same criteria, that's referred to as a no wrong door approach. The telephone-based model usually includes some kind of 211 or similar system and begins the assessment process via phone and then hands it off to another provider. So maybe doing a basic screen for prevention possibilities or just a basic screen of some sort, and then if the person needs more assistance, they might have to go to a second place. That's the model we see most commonly. Mobile case manager model, you're looking at maybe a roving team or a rotating team of case managers, and they may be doing a deeper level assessment. So they may be traveling between different emergency shelter programs or things like that, kind of seeing what the need is and doing assessments that way. And there are a few communities we know that are using that model as well. And a mixed model can be kind of a combination of all these different things. So one community may have different models per subpopulation or within the same population. They may use a 211 with a decentralized approach, for example. So there's a lot of possibilities here in terms of how this can work. Another important thing in the regulations in terms of coordinated assessment is that there's a new requirement that communities develop consistent written standards that establish, at the very least, eligibility and prioritization criteria for transitional housing, rapid rehousing, and permanent supportive housing. And they also have to set up a consistent method for determining the amount of rent a household would pay in a rapid rehousing program. So there needs to be some kind of standard or formula for that. This is really meant to help communities make sure they're being consistent across the board, which is also kind of an underlying theme in developing a coordinated assessment process in the first place. And I put here at the bottom with an asterisk for high-performing communities, they also have to have written standards for prevention assistance. And you can only provide a prevention assistance under CoC rules if you are a high-performing community. So there's actually a lot to say about these, but I'm going to save that for our recommendation section later. But I think there's a lot of opportunities to use these written standards to make sure that people are being targeted to the right interventions based on the need they have. A quick few other items of note in the regulations. HUD really emphasizes that they want communities to design their system based on their own local setup and their own community. So you want to think about things like the size of your community, the physical size, as well as the population size, the type of area that you're in. So a rural area versus an urban area may have a very different setup. And I think the message here is that there isn't one right way of doing this. There's kind of one set of goals in terms of making things more consistent and better matching the resources we have to the need in the community and helping people return to housing as quickly as possible. There's a lot of different ways that can look. So while looking at other models can be great in terms of beginning the planning process and seeing what's out there and what the possibilities are, ultimately communities will need to create their own model, which may not look like any other one that's out there right now. A second important thing to note is that these coordinated assessment regulations also apply to Emergency Solutions Grant or ESG grantees. So there should be a lot of collaboration from the beginning between the ESG and CoC stakeholders to make this work. So now that we've kind of covered what the regulations say in brief on coordinated assessment, and again, I think the message is really just to start planning for this and getting things started and start thinking about how this will look. I'm going to talk a little bit about the key aspects of coordinated assessment. So when we use the term coordinated assessment, and some people say coordinated access or coordinated entry or coordinated intake, I think sometimes it's confusing for a number of reasons, but one of those is that it seems like we're only talking about one aspect of this. So if we're saying coordinated assessment, maybe we're just talking about the assessment process. While in actuality, there's a lot more to this whole process, whatever you want to call it, than just assessment or just intake, for example. So these are what I would say are the 6 key aspects to any coordinated assessment process, which are access, assessment, data entry and sharing, referral, program intake, and system change. And we'll touch about each of these 6. I'll say there's an asterisk next to program intake because I think it's important to remember that not everyone's going to have to enter the system or should have to enter the system to get served. So there's a lot of possibilities around prevention and shelter diversion where you may be helping someone, but they're not entering a program per se. So to begin with, access and assessment. Access is really about helping people get to where they need to go to be assessed. So this applies to at-risk households and households experiencing homelessness. When starting on this path of establishing an assessment process, communities have to think carefully about things like transportation. So how can people get to wherever the assessment center is? You want it to be obviously easily accessible. And also things like what's going to happen with households after hours. So if your assessment process isn't going to be 24/7, and it's great if it can be, you need to have a way to house people or to help people overnight if they run into trouble. So what's your plan going to be for those households? A natural place to start looking for potential assessment centers is your larger programs, especially shelters where the majority of the population may already be going first for assistance, so they may be well known in the community. And it's not always possible to use those programs. Again, every community is different, but that might be something to help you start thinking about where to begin. It might also be crucial to have multiple types of assessment points for communities depending on the size and the subpopulations you're serving. And I'll touch on this a little bit later when we talk about domestic violence survivors, but there's also some safety considerations here. In terms of the actual assessment process, which we'll use to help determine what services and housing opportunities a household may need, I want to emphasize, although the regulations say comprehensive, I think it's much more important to think about assessment as a process. So it may begin with something very brief, like a prevention or a diversion screen, and then followed by something determining the need for shelter that night, and then later on a more intensive screen for barriers to reentering permanent housing. So I don't think it needs to be kind of this one-shot tool up front that's 5 hours long to ask all of these questions at once. I think it needs to be kind of more nuanced and go through some stages to allow people time to figure things out, and again, to make sure that you're giving people the opportunity to kind of start with something small rather than kind of jumping the gun all the way to the end. And we'll talk about kind of developing that balance a little bit later. Another important thing to think about with assessment is that you want to make sure you're distinguishing between the questions whose answers you need to place someone in the right intervention, which is more of an assessment thing, versus the questions that individual programs will be asking later on to guide case management efforts. So there are some questions that are more appropriate once a person has entered a program and they need more specific information. And I think we can do with a lot less questions kind of at the beginning in the assessment process. In terms of data and referral, data, it's really about having a consistent way for gathering data, entering data into HMIS when that's appropriate, protecting sensitive client information, and sharing information across programs. You want to cut down on the need to enter people more than once, obviously, and data duplication. And I think there's a lot of opportunities within the coordinated assessment process to really standardize how data is collected, to really get that in writing. And if you have a process for this that's written out, I think it makes it a lot easier to do. Also, something to think about here is could you build in something like real-time bed availability into your HMIS? I think that's an important thing to start exploring. For referrals, there's going to be a lot of consumers that need referrals to other programs or resources. And so it's important here to begin thinking about the criteria you'll use to decide where consumers, quote unquote, fit within certain interventions or within the system. So you need some kind of process that's consistent and based on the best information you have, which should include kind of national best practice as well as local data, using information you have about how well people have done in programs in the past in terms of looking at different subpopulations and those kinds of things. It's also important here to remember that a lot of households are able to kind of enter and exit the system quickly. So again, this is the balance I was talking about before about making sure that you're giving people what they need, but also giving them the opportunity to work things out first. And the last of the 6 here, in terms of intake and system change, intake, again, may not be necessary in every case. Not everyone needs to be part of a program to be helped, I think, in a housing program. So again, there's prevention and diversion opportunities for some households. But again, just making sure that you're not duplicating the questions that are being asked at assessment and at intake, that there's a difference. And also, within the system as a whole, once someone's in a program, I think it's important to go along with all of what's happening around performance outcomes and around what's being expected of communities, that you're really working with people on helping them return to permanent housing. So those are kind of the 5 specific things that are really a piece of coordinated assessment, but I think there's sometimes a larger piece that gets lost in the shuffle, and this is a big deal, and it's a big change for a lot of communities, so it's more than just changing your assessment process and changing how you collect data. It's really a system change. It refocuses the system on consumer need. It takes away a lot of individual staff and programmatic decision-making in favor of informed system-wide decisions. And it asks for a lot more coordination and collaboration than most communities may have right now. So it's a big undertaking, and every community that we've talked to you about this has said it takes time. It may take different financial resources. It takes a lot of communication and cooperation, and it takes a lot of tweaks. And I think it's important to kind of cut yourself some slack up front that you'll inevitably make adjustments to how your process works. So it's important to be patient and remember why the effort is worth it beyond the fact that it's now mandatory. And that's because it makes things easier on the consumer, and that's something that we've heard time and time again from communities that have talked to their consumers about this. And it gives us all a better chance of matching the needs to the resources we have, which makes a more effective and efficient system. So now I'm going to kind of move into our recommendations based on what we saw in the CoC regulations, and we'll have next steps as well. But these are, again, really focused on what was in the regulations themselves. The first one really speaks about domestic violence survivors. HUD made it clear that they want to ensure domestic violence survivors have access to homeless assistance resources. And in a lot of communities, that's already true. They also said that domestic violence providers will either be required to participate in the same coordinated assessment process as homeless assistance providers or develop their own coordinated assessment process. Having one system for both populations, so for both domestic violence providers and homeless assistance providers, could be ideal for several reasons. It can make it easier for survivors to access housing resources that might be easier to access in the homeless assistance system, and it can also increase collaboration between domestic violence and homeless assistance providers. I think that's something that obviously HUD is still taking comments on, and we're still learning a lot about how that collaboration could work, but it's certainly something worth thinking about. Regardless of the models that communities choose, you have to make sure that your assessment process can accommodate the safety and confidentiality needs of survivors. And you should have a consistent strategy for bringing domestic violence providers to the table when making plans for the homeless assistance system. So I think, again, a lot of communities may already do this and incorporate domestic violence providers into their planning, but it's really important that you start thinking about how to do that now. And I'll give you a really specific example about where that's important in this process, which is the location of your assessment centers. As HUD says, you want to advertise a location so people can find it, but for survivors, that might also pose somewhat of a safety risk, having a well-advertised place where an abuser might be able to find them. So by bringing domestic violence providers to the table, you can talk about other options that domestic violence survivors might have for accessing the system, such as a telephone intake or a telephone assessment of some sort, or even making a domestic violence provider one of the front doors to your system. And I've put in this slide a couple examples of different communities that have worked well and integrated domestic violence survivors. Just last week, we at the Alliance released a domestic violence checklist related to coordinated assessment, and that's currently in our coordinated assessment toolkit. And that has some more kind of questions like this around location and other issues to think through for communities as they're making this plan. So that's definitely a good resource to check out. The second recommendation is around prevention and shelter diversion. A lot of people seeking homeless assistance still have a chance at hanging on to their previous housing situation, whether it's their own housing or the housing of a friend, a relative, or a coworker. We know that a lot of people actually come to homelessness not from their own housing, but from staying with a friend or a family member. Because of this, prevention and shelter diversion are key interventions in the fight to end homelessness. And I just want to make sure that everyone understands what those terms mean. So prevention is, again, offering kind of short-term financial assistance usually, or sometimes just mediation to help someone stay in their own housing. So if someone is losing their apartment, finding ways to help them stay there so that they don't become homeless at all in the first place. Shelter diversion is a scenario where someone is coming to the homeless assistance system saying, I need help, I don't have anywhere else to go, that may have come from a situation where they were staying with somebody else, and figuring out a way to help them stay in that situation. So rather than having them enter an emergency shelter or transitional housing program, helping them go back and stay with that friend or family member, and also potentially working with them to help them find a more permanent situation. Screening for these two possibilities right away at the front door is important and can preserve emergency beds for households that truly have nowhere else to go. For families, we've talked to a number of different communities about this, and a lot of them are giving rates between 15 to 30%, diversion rates between 15 to 30%, which means that that's opening up 15 to 30% of their emergency shelter beds, which is great. Ideally, to make this work easily, you want to make access to rental subsidies and case managers available at the front door. So wherever the assessment is happening, you want those resources to kind of be available. Case managers can play a really important role in mediating disputes, kind of talking to either a landlord or the person the household was previously staying with. And this is another topic where we have more resources. If you're interested in learning more about prevention targeting, or diversion, we have a whole toolkit just on this on our website. So I think number 3, which is breaking down program barriers, is actually the hardest of all the recommendations that we're making. If any of you are at the coordinated assessment workshop at our conference, you've heard me say this before, and that's in order for this system change to happen and for coordinated assessment to be successful, you really have to think about not just changing your system, but going beyond that and changing your programs. In order for your system to accommodate this new kind of way of doing things, your programs have to be on board with that. And the reason that's necessary is that we want to make sure that people aren't being screened out of the programs they need the most. This requires taking a hard look at your program model for program staff, looking at your mission, looking at general best practice across the country, and the role of each program as being a part of a larger permanent housing-focused system, which is the system I think all of us want to become. So a big part of this is just starting with something simple, which is what are you requiring with people to enter your program? And is that preventing people from entering the program that, for example, really needs intensive service resources or other things that you can offer? And some of the most common barriers we see are related to income, employment status, or sobriety. But the reason these can cause problems is that sometimes if we're putting these barriers in front of people being able to access programs, we end up screening out the people, preventing the people from accessing these resources that need them the most, that are really needing the most intensive resources. On the system level, this also means looking across programs to determine where program requirements may be interfering with serving certain populations and trying to assess the needed amount of each kind of type of service based on data about cost, the outcomes of different programs, and the size and the needs of different subpopulations. So again, it's really about if you're referring people to programs, you need to be able to send them somewhere. And I think there's no system around that can say that no one is falling through the cracks the way things are right now. And while this isn't the whole story behind that, a lot of that is that individual program requirements can actually keep people out of programs they need. So again, it's a system-wide effort looking at all programs to see, where can we loosen things a little to make sure that this person gets served. And I think that's one of the biggest things of this whole process is that coordinated assessment is meant to make sure that people aren't falling through the cracks anymore. So the last recommendation gets back to the written standards that we talked about before and the opportunity that exists there. I'm going to keep repeating this, but you want to use this opportunity with coordinated assessment and in particular these standards to apply what you've learned to the local and national level about the efficiency of different interventions. For example, we know permanent supportive housing is the most effective with chronically homeless households. So prioritizing those kinds of households for permanent supportive housing makes sense. And that's an easy example, but just kind of going down the line and looking at who is best served by this based on outcomes, based on, again, best practice, based on capabilities of different programs to serve different kinds of people. A lot of times your higher cost, very service-intensive interventions are actually set up to best to serve the households that have the most barriers to returning to permanent housing. I also put in this piece about progressive engagement, and that as a concept basically means just giving a household or a person a little bit more and a little bit more until their needs have been met. And I think you can apply that to coordinated assessment by saying that you want to give people the smallest amount of intervention or resource necessary for them to be stably housed again. And I think the way to kind of look at that and to do that is providing opportunities like prevention and diversion to everybody. So seeing if someone can be prevented or diverted before sending them to any other program. Finding ways to make resources available outside of having to enter the system. I think one of the biggest things that we've learned is that sometimes people stay in our system longer just because they're waiting out a resource, like a housing voucher. So if we can find ways to make our resources more flexible without forcing people to enter shelter or enter transitional housing to get to them, maybe we can prevent people from entering in the first place. And again, that's also a system change concept. So I think the whole message behind that progressive engagement piece is really, before we just keep sending people to a more intensive intervention, trying to find opportunities to serve them with a little bit less and help them be stabilized with that little bit less. Now I'm going to move into some next steps for communities to take. And this will kind of build on what we've discussed before, but will also include a little bit more specific information for communities that are kind of wondering, well, how do I get this started? I think the first thing to do, if you haven't done this already, is to develop some kind of committee to head up the coordinated assessment efforts. It's a big job, and I think it's really important to have people that are devoted to working on it specifically. The committee doesn't need to be all providers, and in fact, I don't think it should be. I think it should be some major funders, perhaps a few emergency shelter operators, and definitely representatives from the ESG and the CoC side of things. I also think communities in general have a good feel for who needs to be involved in these different kinds of things. And I'll also direct you again to another resource we have, our coordinated assessment checklist, that kind of lays out even more step-by-step how to get things started, and this is one of the things it addresses. So I think you want to start with kind of a small group of people that are committed to working on this issue. Some things to start doing right away are, again, looking at different models, looking at what you have already. I think sometimes communities just want to throw things out and start all over again, and this is certainly an opportunity to look at things differently, but a lot of communities have things like a 211 or a large shelter that can be good starting points in figuring out, okay, well, maybe we can make this our front door. This is something we're doing already. You may already have a front door process in place for a certain population, so I think it's also important to build on what exists already. Another thing I want to point out that I think is really important is in terms of consumer involvement. Another big message in the CoC regulations is that consumers need to be involved in decision making. You need to have a consumer on your board now if you're a recipient or subrecipient of CoC funds. And I think this is a really good point for them to be involved. Talking to consumers about where assessment centers should be, how they access services, how they found out about services can be really informative in terms of figuring out next steps. Wait for that slide to change. So I broke down each of these next steps according to those kind of 6 key aspects I discussed earlier. In terms of access and assessment, I think these are pretty clear. You want to figure out what model of coordinated assessment you want to implement or what would make sense, and also start looking at different assessment processes or tools. Most households, again, I think should go through a very basic prevention diversion screen first before diving into something more intensive. Some communities don't do it that way, but again, I think it's important to give people opportunities to not have to enter the system if it's possible to help them otherwise. And if you're going to do it that way, I think, too, that you can do that next assessment that might happen in emergency shelter, for example, might address things like housing barriers. So with the whole rapid rehousing approach, we talk about this a lot. What are your barriers to reentering housing? And I think at that point, you may get into some of those questions. If you're looking for specific examples of assessment tools, we have several already in our assessment toolkit. And I'm also hoping that as part of today's webinar, if you're a community that's using an assessment tool that you think is really great, that you'll send it to us. I think it's always, again, every community is different, and different assessment processes will look and feel different, but I think it's always good to have something to look at so you're not reinventing the wheel. For data and referral, I think in terms of data, a lot of communities are at different places with their data. Some are very happy with the consistency and the accuracy, and some aren't. So I think for one, you want to look at what your HMIS is able to do already. Can you already enter assessment information into HMIS easily? Can you already track real-time bed availability, which obviously has a big impact on your referrals? And also, I think it's a good time to be vocal about things that you may need in your HMIS that you don't already have. I know I've heard that HUD is, talking to HMIS vendors about what some of these changes will mean on that scale, but it's good for communities to identify that for themselves as well. What data tools will you need to make this work? If you don't already have some kind of data release form for clients to fill out once they access the system, or some kind of MOU between programs for sharing data, again, I think the ability to share data, what you see in an open HMIS, is really important. It makes things a lot easier. And I've heard that that can also be very difficult for some communities to develop, but I think it's definitely a conversation worth having. That's also something you want to think about. For referrals, I think really talking about these written standards and what they're going to mean and starting to work on those will actually help with that process a lot, because really the written standards are about targeting people for different interventions, and that's what referrals are really about as well, is looking into information you have in the household and finding the best fit. So there's a lot of connection between those two things. So I think having those conversations about how you'll score certain things, for example, in terms of making referrals and how that kind of overlaps with the written standards goes a long way. This is also, I think, a really important time to start looking at the data you may have. You may not have much, but any data you have on outcomes of people exiting certain programs or types of programs is really helpful, I think, in figuring out the referral piece of this. For intake, we talked about this a little bit already, but cutting duplication. So again, not asking the same questions at assessment as you do at intake, sharing information so that doesn't happen. You also want to think about, if you're referring someone to a program, how they're going to get there. And again, this depends on the community and the transportation options. And things like, what happens if someone's referred to a program and they don't show up? Does someone follow up with them? Is it the front door staff that would follow up with that person, or is it the agency they were referred to? All of those kinds of details, I think, are things it's worth start thinking about those things now, just in case. In terms of the system change aspect, I think it's obviously all about communication at this point, talking about the changes that the committee or whoever's in charge wants to make, talking about how this could look or how it could work in the community. And a lot of that starts with really hitting home and really emphasizing that the side doors, for this to really work as one process, will have to close. Side doors or any other way of accessing the system that are outside of coordinated assessment. So it could just mean, someone walking up to a program instead of going to the assessment center. There has to be a community commitment to cutting down on those things to make sure that the process stays consistent and isn't getting sabotaged. And again, this is also a good time to start looking at those program entrance requirements, both on the program level and at the system level. A few other things to consider when you're thinking about a coordinated assessment is that different subpopulations access the system different ways. So again, you want to look for ways to capitalize on existing structures in place for different subpopulations and create an assessment process that takes those different ways of accessing the system into account. So you may have one big family shelter that might make sense for your family front door if that works, but maybe youth or domestic violence survivors or single adults access the system different ways. Maybe one population uses 211 a lot and another doesn't. So this isn't just building a system for one set of people, though a lot of systems have started that way, and that can make things a little bit easier to think about. You want to make sure you have something that works for everyone. So you want to make sure that you're looking at these different groups to figure out how to make this work for them. And part of that falls into the second bullet point, which is the role of your outreach team. A lot of times, in terms of the chronically homeless population, a lot of households may have their first encounter with the homeless assistance system through an outreach worker. So I think there's an opportunity there, and I think some systems have started to think about this, to equip your outreach workers with things like a vulnerability assessment or other ways for them to do the assessment themselves and refer people to certain interventions. Or you could have something where an outreach worker maybe accompanies someone to an assessment center to be assessed, but that's a really great resource a lot of communities already have, and they're making that first contact already. So I think it's a good idea to think about how they can fit into this whole puzzle. And finally, and I know we're just getting started with this, so it's hard to think about evaluation, but it's an important thing to think about. You want to think about how you're going to figure out if this is working or not and what tweaks need to be made. Obviously, the hearth outcomes in terms of looking at new entries and lengths of stay are really important and are going to be important across the board. And also consumer reporting. So I think it's important to build in some element for consumers to report back about their experience with the system. We also have an evaluation tool that we've developed that you can look at kind of pre and post implementation to see the difference it's made and look at the changes. Depending on the community, it may be, your wait list looks different, your length of stay are shorter, et cetera. But you want to think about how you're going to measure those things, because you want to make sure you're getting kind of a baseline measure of where all those things are at right now. I think in terms of the data, it's not just about getting good and consistent data, but also realizing that you want to have data that you can use to better shape the system. So this is, again, and I keep saying this word opportunity, but coordinated assessment really is an opportunity for the system to gather more consistent data and use that data to say, okay, we have a lot of people coming into the system that need this, that may have, if you want to call it, scored for a certain resource, and we don't have enough of that resource, for example. That's a really good argument. Having that hard data is a really good way to convince funders and other stakeholders in the community that we need to make some shifts or we need to fund some different things. It's a really good opportunity to get a lot of information, and I think that's something that people sometimes forget when they're going through this process. So you want to use this time to also figure out how you're going to capitalize on how all of these changes have worked. You want to think about, how am I going to use this information to make a better system? And that goes back to that system change piece. So I wanted to just share, kind of in closing of me talking, some of our other resources on coordinated assessment. CUT is working on coordinated assessment. I think several things, including a guidebook that should be out soon. I don't have an exact date on that. And the ICH website has a whole toolkit on retooling crisis response systems. It has some good resources in terms of looking at prevention, diversion, and coordinated assessment. What I'm going to pull up now, that hopefully you'll be able to see in just a second, is our coordinated assessment toolkit. So if you haven't seen it, this is something that you can kind of check out. And I just want to show kind of everybody where it is and what resources are there. So you can access it from our webpage either by searching for it. There's that bar at the top left if you type in coordinated assessment. Or you can go to this training tab on the right-hand side and click front door strategies. And once you get in there, it's the second thing down on the page under the spotlight. So it says Coordinated Assessment Toolkit. And so we have everything in 4 different sections to make things easier. I hope this is big enough. If not, I apologize. So the first section is planning and assessment. So this is where you'll find this webinar once it's posted. This is also where we have a lot of PowerPoints and presentations that we've done. The checklist that I mentioned earlier about kind of getting started with things. And this is where we also have a lot of the assessment tools that I mentioned earlier. So if you're looking for an example of different assessment tools that communities have submitted, this is where you would find it. I'm going to go back one. The data and implementation section is the second one. I'm going to slow down a little bit again because I know the screen is kind of catching up with me. In terms of data and implementation, this is where we have things like the MOUs between different agencies. This is where you can find the data release forms that clients would sign if you're looking for examples of those kind of different documents. And we've had a lot of submissions here from different communities. So if you're looking for something like that, this is a great resource. Our evaluation section has just 2 documents in it. One of those is a survey to give to consumers to get their opinion on how the system is working. The other is just the evaluation tool that I mentioned earlier that we've developed to kind of help you 6 months before perhaps implementation and then afterwards, or I believe 6 months after implementation, to see the changes that have been made and where you might want to make some adjustments. And as we get more evaluation materials, we'll add those in. And I'll show you the last section here, which is the community examples and materials. So anything that's not kind of under a specific category, but that we've gotten from a community would be under this section. So if you're looking for webinars that we've done with specific communities, PowerPoint presentations from our conferences, this is where you would find that. And again, we're always looking for more submissions. So I think this can be really helpful. You just want to get a feel for what other communities have done and why they've done it. We recently got some materials from Philadelphia that I think are really great job descriptions for people working at their front door. So I just wanted everyone to kind of see that and know that that's available. We try to make a really big effort to continue to update all of this stuff as we develop new stuff, as other people develop great stuff. So if this is something that you're really interested in, you'll be working on a lot, I think it's a good thing to look at. And with that, I think I am done talking, so I think we can turn it back over to Norm.
Thank you very much, Kim. That was a lot of information. You covered a lot of ground there. That's great. So let me just quickly, again, get back to some housekeeping things. First of all, I know a lot of people have been asking, and I will say this webinar will be available on our website in about a week. And we will post the sort of the video portion of it. We will also post the PowerPoint slides. And I will say that if you are familiar with PowerPoint, there's a section to do presenter notes. And this slideshow comes with a lot of really great presenter notes. So a lot of the information that Kim presented, she was kind enough to write in the notes that correspond with each slide so that you can really get most of the content from this presentation just right out of those notes and by looking at the slides. So that will all be available on our website in about a week. Again, if you want to ask questions, there on the right side of your screen is a questions bar or a questions box, and you can just type your question right in there. And we have a list of these, and it'll show up, and we'll go ahead and ask it. And if there are some we don't get to or that we can't answer, we will try to address those in follow-up materials, including our blog or other resources we've put up. And lastly, before we get to the questions, I want to repeat a plea that Kim made, which is that, as you can see, there's a lot of information from various communities on our website, and a lot of how we learn and how people learn about how to do this stuff better is by sharing information with each other, even if you don't think it's the greatest thing in the world. If you have any of these kinds of materials or materials that might be even a little helpful, I'd ask that you email them to us. In fact, I'd ask that as soon as you hang up the phone, you email them to us. And you can email us at info, I-N-F-O, at naeh.org. And we will take a look at it, and we will not post anything unless we ask permission for that first, so you don't have to worry about us letting your secrets out. So with that, let's get to some of the questions. First question is from Phil. It's about how do you suggest convincing agencies and other providers to participate in coordinated assessment? The ones that are funded by HUD are obviously going to be required to participate, but what about those other organizations that aren't HUD funded and aren't really mandated to participate? How do you suggest that communities approach those organizations to convince them to participate?
That's a great question, and a tough question. I'd say I don't have a kind of a silver bullet for that one, but what I have heard communities say is that they've approached it, again, from the consumer perspective, and I think that's where that can be really powerful, is they've gone to these providers and said, listen, we've got this information that it makes things a lot easier for our consumers if they can go through a process like this, where they don't have to constantly call around, where they have access to everything at once. It makes their lives easier. It makes them less stressful. It makes us better equipped to serve them. And I think, again, it depends on what provider you're trying to bring to the table, but that can certainly make a difference. And if there's some way that you can kind of get consumer feedback on how your system works now, if they think it could be more effective, I think that's always a really powerful tool. I think it also, again, it depends on which providers you're trying to get there, but I think that's a really great place to start. And again, I think maybe a way to kind of begin the whole process of working together, if you haven't tried this already, and you may have, it's just kind of inviting people into the conversation. Some of these providers, I feel like, that may be resistant to the idea, feel like they haven't really been invited to the table on other things related to the homeless assistance system. So if this is someone that I think maybe experienced that feeling in the past, if you kind of start by inviting them to some meetings about other topics even, and just engaging them that way, I think that can also be really helpful, showing them that you care about their opinion and that it's valuable.
That's a great point. I also think that it's worth trying to sell some of the benefits to a provider agency of coordinated assessment. I know one of the things I hear that people, that providers are concerned about is they don't like turning people away, or they don't, it's difficult to take all the phone calls, especially when you don't have space, and to essentially, in some ways, in many communities, every single homelessness organization is running their own information and referral hotline, and I think a lot of organizations wouldn't mind if that process were centralized and it could be taken off their plate. So that's one sort of potential benefit. And also, if you can organize it, I know you talked a lot about data and getting your data in order, but that really has potential benefits if people can come relieve some of the data input and data collection burden on some of those providers when a person comes through the coordinated assessment process first. So some good suggestions. So question about 211 and using 211 for central intake. And this actually is related to some other questions people have about how you fund different coordinated assessment strategies. So 211, generally, you need to have funding to add functionality to 211, but also other coordinated assessment systems. Can you talk about some of the ways you've heard about people funding these things?
Sure, and I think there's a variety of different ways out there. I'll say, I think it's pretty much the same for all homeless assistance in terms of the range of things you're going to see. So I think in some communities it's foundations, it's United Ways that play a really big role in this. For some communities, I think they use their HPRP dollars. I know one community that we've talked to has a special tax. They were able to use that money towards homeless assistance services, and they chose to designate that money toward coordinated assessment. So I think basically communities are looking at whatever is available to them, and obviously there's funding built into this new round of HUD funding that can be used for coordinated assessment. And it also depends what functions you're trying to fund, because I know for some coordinated assessment centers, their case managers may be funded under something, and then HMS may be funded under something else. But I've heard a mix of things. I'd say HPRP, obviously, which is going away, was a big one, but also, again, United Ways, foundations, kind of patching together those different funding sources. Mm-hmm.
And do you think there are sort of organizations that are already performing, like 211 is a good example of something that's already doing some of that you can mm-hmm. sort of add this coordinated assessment, or at least parts of the coordinated assessment process to. Are there other kinds of organizations that you've seen that are already doing something similar to coordinated assessment, where maybe there's a deal to be made there where they could take on some of the coordinated assessment functionality?
I think a lot of that, from what I've seen, is 211s and emergency shelters. I think in a lot of communities, their shelters have been the ones where they've kind of seen that maybe this is happening already in some ways, and that it's easy to kind of expand their role in that. And I'll also say I've heard communities talk about things like day centers that they may have used for different things now. If they have a lot of people coming to day centers, maybe thinking about transitioning their role a little bit into being more of an assessment place rather than just kind of a service place.
Uh-huh. And are you familiar with some public agencies that take on the coordinated assessment function? I know I've heard about some TANF agencies that sort of take on the coordinated assessment function for families, homeless families, but I don't know if you've heard of any other similar examples.
Yeah, I think there's definitely some opportunities with departments of social services, and when you mentioned, I think there are definitely some kind of county or city agencies that may be serving that role, whether it's kind of directing people to shelter now, maybe they can kind of, again, expand their role to doing more of an assessment. But absolutely, I think it doesn't have to look one way, and I think you should look at kind of any partners that may already be doing a piece of this, and that absolutely includes public agencies.
Uh-huh. And so another question here from Celia. So is coordinated assessment, she asks, is coordinated assessment meant to cover just emergency services like shelter prevention, diversion, or also more permanent housing and things like permanent supportive housing and universal housing applications and things like that?
I think it can cover all of those things, and I think ideally you can include as many different interventions as possible to kind of ease people. If people aren't just going to end up going to one place, that may not work for every person. I think it's great to expand the process to include as many interventions as you can. That being said, I know a lot of communities have started with maybe one set of either serving one population, so just families in their shelter and transitional housing and rapid rehousing programs, and others may have started with just, prevention and emergency shelter. But I absolutely think it's worth trying to incorporate as many of those different housing opportunities and service programs as you can.
Uh-huh. And I actually I was thinking back to something you said also about the whole thing being a process and not just all happening at once, so you don't have to, you may not necessarily be assessing for say, permanent supportive housing or an intervention like that the day somebody comes to the coordinated assessment center or engages the coordinated assessment process, but maybe later on in that process, those things are connected together. So maybe, maybe the process is to give one thing a chance to work for, 30 or 60 days, and then if that doesn't work, then the coordinated assessment process can generate a referral to supportive housing or some other kind of intervention.
Definitely.
So some questions about, here's an interesting question about 211s doing prevention and diversion, and question about whether the data tracking for those kinds of things, whether it's necessary for that to happen in HMIS, or whether the HMIS entry into HMIS would happen at some later point, say when a person moves into, either engages a program that has to enter data into HMIS or enters an emergency shelter or something like that that would more naturally put data into HMIS. Do you know some of the communities you look at, do they really, is HMIS deeply integrated into this right from the start, or is there a process or a time when HMIS tracking starts?
So I know there's a few different communities that use their 211s in a kind of similar capacity. I think Alameda County in California, I believe their 211 operators actually might start entering data into HMIS right from that point. So right from when they're calling 211, once it's appropriate and they've identified this is a caller calling for homeless assistance. I believe that that's how they do it. I also know there's an area of Connecticut that's using their 211 in a similar way, and I'm not actually sure if they start with HMIS or not, but they've actually worked to train some of their 211 workers on doing prevention and diversion screens. So I think it's easier if you can start with HMIS, but obviously it may be easier on the consumer side, but there's a lot of logistics behind that. So I would say that could be ideal. Obviously there's some training and probably some financial resources that could go into that. I don't think it would have to be that way, but I think it would be easier in the long run for the consumer that way.
Mm-hmm. And we had a couple questions about staffing and you know, coordinated assessment, while it's not the most expensive thing in the world, does have some very real costs, and it does take actual people to do it. Can you talk about some of the ways people fund coordinated assessment and different, you know, some of the, particularly around the staffing positions?
Sure. So I think one thing that a lot of communities have this concern, and I can certainly understand why. And what some communities have talked about is exploring, and I'll be honest, I'm not exactly sure where they are in this process, but exploring case managers that are already working with different providers, if there's a kind of way to kind of share their time, where that would go back to that mobile case manager model. Well, maybe case managers can kind of alternate taking on assessment duties for the community. So that's a really, I think, cooperative approach, but one way to use resources that you already have. And that way you're kind of sharing it among a group of people. So you wouldn't need to necessarily hire a bunch of new staff. I believe Philadelphia has specifically, they have assessment staff that I believe are social workers that I think are just kind of county employees, a few of which are devoted specifically to their assessment process. I believe that'd be funded through just kind of probably HUD and city funding, but I'm not sure exactly. But I think there's kind of a range of models in between that. So I guess in terms of funding, it's possible, and it's something I would encourage communities to look at, that they might be able to kind of use staff that are already in the continuum to kind of assist with some of the assessment duties, especially in the case management side. But if not, I know we have some of Philadelphia's information on our website. It might be looking at what funding exists generally for coordinated assessment or case management, and seeing if you can devote some of those funds to hiring someone that can be available at that front door. And I think that's another great thing about 211 is if you already have people working your 211, kind of training them in a different way, that's a resource that's already there that you can use without necessarily new funding per se.
Yeah. And we had a question about sort of models for sort of city-county models versus regional models. And so can you talk a little bit about, I think it's a little simpler when you are looking at a metropolitan area or a central city where, you know, the geography makes things a little easier because you can have something like a centralized location where, you know, everyone can physically go, or a few locations. But when you get to something like, you know, the northwestern region of a particular state, for example, you have a whole new set of challenges. So what do people do to sort of try to, you know, meet the challenge of geography?
So I think, and I think this applies especially in kind of rural communities and things like that. I think what I've heard most commonly is that A, they look at a telephone model to start, so just having one number for the area that people can call that can then refer them to whatever place is closest to them, and B, looking at a decentralized model where you have a number of different providers, obviously, that are scattered across that area, that are able to do that assessment and referral process, so that it's a consistent process no matter where you are. So I think it really comes down to figuring out, again, it can be a larger area that this applies to, but I think for a lot of places it's not realistic to do a centralized approach, and what they've done is just kind of tried to have at least one provider in each kind of area, like that hub model that you just mentioned, that can kind of perform those duties as best as possible. And if not, I mean, again, I think the telephone model can be an option until you can kind of figure out how to meet that need.
I do want to tell people who are listening that it's 3 o'clock now, but we have a lot of great questions, so we're going to go on for a few more minutes. You're obviously welcome to go, but just wanted to let you know that we're still going to take questions for about 5 or 10 more minutes here. So an interesting question about, well, I'll just quote it. She asks, what is the best process for choosing the questions to be included in a screening tool to be used system-wide?
Oh, that's a great one. And I think that's something that a lot of communities struggle with. And I would always say that you err on the side of asking too little questions, especially in the assessment phase, as we've talked about kind of throughout the webinar today. I think it's good to have a process and not try to expect to get everything up front. So I think we have some sample prevention diversion screens, for example, where it's just a few basic questions. Where did you stay last night? Could you stay there again with some support? I think as you get more into that process, those questions may get more in depth. For example, if you've done the diversion screen and the person can't be diverted and they're in shelter and they've been there for a week and you're doing an assessment again, then you want to start looking at, those housing barrier questions, looking at income, looking at rentable history and those kinds of things. Generally speaking, I would say you need to ask yourself, is this a question that I need to know right now to figure out where to send this person in terms of intervention? And I would say on the intervention level, not necessarily at the program level. So is this going to help me make a difference or distinguish between sending them to this type of intervention or this intervention? And again, it depends a little how you set up your assessment process, but I would always err on the side of less or fewer questions.
Yeah, I completely agree, and I remember talking to somebody about their assessment process, and she told me that what they found they had to do is they would put in questions that they thought would help, and they weren't actually that helpful, but there was never a process to sort of go back and look through their assessment process to see what questions were no longer needed, and so they really went back and did this sort of an audit of all the questions in their assessment to say, is this really helping us? If not, then we'll take it out, and really trying to again keep streamlining and minimizing what's in the assessment just to the stuff you need to make a good referral decision.
Absolutely.
So another question about, this is sort of about the culture of assessment and screening and intakes. But she asks, a lot of assessment tools have been created to screen people out. What can be done to change this overall culture and thought?
Ooh, that's a big question. I think the assessment tools are sometimes the issue, but again, I think a lot of it is actually talking to programs about the requirements. And I think that's a really big piece of this whole written standards piece. And a lot of people, what they'll try to do, I think, is develop a coordinated assessment system without really looking at those standards. They're pushing too hard on them, and they find that they're having the same problem. So I think, again, the focus needs to be, and the message needs to be, we have to find a place for everyone that needs our assistance. And this is kind of a system-wide accountability factor, and really drilling that into people's heads that if so-and-so is not going to be served by your program, we still have to find a place for them to go. And I think there's some really good models out there in terms of helping providers understand in those systems where they do kind of allow providers to push people back. They don't think that's a good fit, which, I think every team has to make that decision for themselves, but I think obviously that invites some issues there. They actually will make those providers sit down and say, okay, well, this is so-and-so situation. How are we going to work with this and find a place for this person to go? So I think it kind of goes beyond the assessment tool piece. I think a provider gave really good advice to us once, and she told us that, they got really hung up in their community about the assessment tool, and they actually don't think that's even the most important part anymore. I think it's really those conversations with different programs where you're, again, looking at, what are you asking of people and helping them understand, if you're saying that so-and-so has to have, for example, X number of dollars to enter your program, well, that's screening out all of these people over here. These are the people who are on the streets and aren't being served. And so how can we make this better? And really, expanding that conversation to all kinds of providers and all kinds of interventions. I think that's a really important piece of this. And in terms of the tools, I think, again, actually asking those fewer questions can actually help with some of those screen out factors.
Mm-hmm. And so we have a lot of questions about domestic violence and the sort of interaction between domestic violence and coordinated assessment. And I think you give a few very nice hints to people about how to approach domestic violence survivors and victim service provider organizations. And I know we included some materials to help make that, to help people navigate that issue. Do you have any other sort of suggestions for people who are concerned? Well, everyone's concerned about making sure that coordinated assessment doesn't compromise the safety of survivors. And at the same time, we've, I think as you mentioned, the communities that have implemented coordinated assessment and integrated their DV services have found that it's a great benefit to survivors and to the people who access the regular homeless system, many of whom also have backgrounds that include domestic violence. So, I mean, do you have any other sort of hints for people or suggestions for how they should, you know, go about that? And also, you know, what resources are we producing or the HUD producing that, you know, could help them navigate that?
I would say, so in terms of our resources, I would definitely say that domestic violence checklist is a good thing to look at in terms of thinking through kind of specific safety concerns, and that's in our coordinated assessment toolkit under the planning and assessment section. I think that's really important and a really helpful resource. We also have a whole part of our website that's just devoted to domestic violence, and one of our policy analysts just did a great series of webinars on different domestic violence issues, and some of which are very relevant to this conversation. So if you just search our site for domestic violence, I think you can pull up a lot there. In terms of within your communities, I really think the most important thing and the best thing any community can do is to talk to their domestic violence providers and ask them these questions. What should we be concerned about in terms of safety? What do we need to know in terms of data? How can we incorporate you into this process? Or what have you learned through doing your assessment? I really think there's no better substitute than that. And I would say that I think on both sides of the coin, I mean, I think sometimes domestic violence providers in some communities may feel like they're not really a part of these larger homeless assistance processes, and homeless assistance providers may feel the same way. And so I really think that the best thing you can do is talk to the providers in your community. If they don't know kind of what's happening with coordinated assessment, talk to them about it. If you have ideas, you know, make comments about it in the regulations as well, if there's something you feel strongly about. But I really think there's no substitute for just that one-on-one program communication.
Oh, I completely agree. And I think you also made a great point about the HUD comments and the HUD rules. HUD requested that people comment on a lot of aspects of the connection between coordinated assessment and domestic violence. So I know they're looking for people's input in that. I also wanted to say that, you know, through our question box, people have answered some of our previous questions. I should have asked everyone to do that. That would have made this a lot easier. But someone from Georgia mentions that statewide homeless coalitions are often the organizations that are doing sort of the referrals, serving as an informational referral body. So there's an organization you can look to. I know also CAP agencies or community action agencies in a lot of communities sort of serve that function for a lot of different resources, sometimes including homeless assistance and sometimes not. But there's another, particularly in rural areas, there's another organization that you could look to as a potential resource to help with coordinated assessment, and it may be something that would mesh well with their mission already, and that could solve some of the funding and staffing problems. Also,
and there's a lot of great national organizations, too, that work on this issue. And I know at the Alliance we've been talking to a lot of our partners about this, so it's another great resource that's out there.
Yes. And also a question here about using the school system as part of the coordinated assessment process. Have you heard of any of the examples of people using either school liaisons or some other, you know, part of the school system as part of the coordinated assessment process?
I do know some communities that I think try to use school liaisons or kind of a similar position to help identify families or children that may already be homeless or at risk. But in terms of real coordinated and structured efforts there, unfortunately, I don't think I have a lot of great examples of that. But I mean, that sounds like a great idea to try to think about how that could fit in.
Yeah, I think I don't remember if this is one of the questions on the questionnaire, on the consumer questionnaire, but one of the things you can look to in trying to identify who's a good partner for your coordinated assessment is to ask homeless consumers what, you know, who they worked with prior to becoming homeless, or who they engaged with, or when they first needed assistance, who did they turn to, and that gives you an indication of, you know, where people are going if they think they need help. And that, you know, can help you identify a potential partner in the coordinated assessment process. So we'll take one last question, and this question is, our coordinated assessment program is considering direct placement in shelters after the consumer has been determined to need shelter, and is asking if there are any drawbacks to this approach.
I mean, I think direct placement, especially when you're talking about emergency shelter, I mean, I think that makes a lot of sense. I think if your shelter provider is on board with that and are willing to do that, that's even better. So I would think the drawbacks would just be maybe some resistance from them. But otherwise, I mean, I think that's really great and can be really important in making sure that someone doesn't end up on the street.
That's great. Well, Kim, thank you so much. And I want to thank everyone who joined our call. And again, we'll have these materials available for you. We'll try to get them out as quickly as possible. And thank you for joining, and we look forward to doing more of these in the future. Thanks.
Thanks, everyone.